Hey guys, yes, this is part 3 or part C of the mental health podcast, CK7 Family Mental Health Podcast. Yeah, so if you haven't watched our previous sessions, kindly do so. You'll be missing out if you haven't. So yes, we handled what is mental health problems, the relationship between unmanaged stress and mental health, what is mental illness, risk factors and triggers, and are there more risk factors and triggers maybe?
Yeah, sure, there are more risk factors. Today we would like us to talk about lifestyle factors. So when we talk about lifestyle factors and how they can affect your someone to getting mental illness, we have factors like drugs and alcohol use.
Okay.
So abusing drugs and alcohol can trigger mental illness, because you will see when you take alcohol or substance, it has a way of affecting how your brain works.
Okay.
So it can affect the function of your brain
and the structure
of your brain. So it can also make it hard to recover from the mental illness, because remember, once you're addicted, it can cause struggle in terms of overcoming the addiction. And so the more you're addicted, the more you're prone to mental illness. The longer you use the substance or the alcohol or whatever it is you're using, the severe the mental illness can be. Wow. So things like smoking can affect your quality of sleep. It can affect your diet. Because when you're taking alcohol, chances are you will not eat. So, and if you're not eating, of course,
your health is
affected, because see, what you eat also affects how your brain works in terms of the nutrients you get from the food you eat.
Wow.
So those are some way, and it's quite long.
It's quite long, but we can call it. Those are the risk factors and triggers, right? Okay. So I want us to enter into the red flags.
Before we enter to the red flags, there's another risk factor, which is how your brain chemistry works. Mental illness involves an imbalance of natural chemicals. So in your brain and your body.
Wow.
So for example, if you're feeling sad or you're feeling really like high moods, it's as a result of
an imbalance.
So some of the chemicals in the brain helps facilitate communication between your body and your brain.
Wow.
Yeah. Okay. So there's the nerve cells and the neurotransmitters. So how your neurotransmitters and the nerve cells work is as a result of that chemical.
Wow.
So some of the main neurotransmitters are things like serotonin.
Wow.
So serotonin plays an important role in mood. So imagine where in areas where your serotonin levels are low. So it means chances you feel not really, you can feel low.
Okay.
Yeah. So it's the roles of this, such as feeling stable, the moods such as feeling stabilized, or maybe cognition, how you think, learning, memory and sleep. All of that is as a result of the chemical serotonin. There's dopamine, and I know dopamine is something most people are familiar with.
They've heard of.
So it also plays the essential role in your brain reward system. So dopamine is like your reward system in terms of when you do something. Let's say you eat some meal you like, the feeling good. When you feel good, there's dopamine released. So this is where it enforces how you feel, the feeling of pleasure. So if you do something and there's no dopamine released, it's like when you invest and there's no returns. So chances are you'll withdraw from those things that you used to do. So dopamine is the feel-good chemical. So when you see now chemical imbalance, means there's imbalance of those chemicals, and it can lead to mental illness.
Wow.
Yeah. Wow. So we have types of mental illnesses, just to mention before we proceed. illnesses are like depression. So when we talk of depression, it means you're feeling sad, you're feeling low, you're feeling fatigued, you've lost interest in things you usually interested in. Yeah. When you talk of anxiety, is when you're constantly worried about things, a lot of worry, and it comes with physical symptoms as well. We have schizophrenia. Yeah.
What is it?
Schizophrenia is when sometimes you may see things that don't exist, like when you are hallucinating, or maybe you believe being in things that don't exist, or
seeing things
false
that are not
beliefs,
there.
seeing things that are not there. We have personality disorders. We are like maybe having problems in relationships or feeling suicidal, self-harming. Those are some symptoms in those illnesses. There's eating disorder. You've heard of where girls eat and then, not girls only, even boys, but mostly girls. You eat and throw up because you don't want to add weight, or those are some of the disorders. There's also post-traumatic stress disorder, which is also among mental illnesses, where you've experienced trauma in the past and you're affected by what happened in the past. Yeah.
Wow, guys, you've heard of the types and the risk factors and triggers. So I think that is enough for part 3. Yeah. So I think we'll leave the rest for part 4. Yeah. So thank you very much for being with us. This is a mental health podcast. Yeah, we're just talking about mental health, an overview of what exactly mental health is. Just everything mental health that can be useful to you and enlighten you and what exactly it entails. So thank you very much for staying tuned. Catch us in the next one.
See ya.
Have a good one. Cheers.